So welcome everyone. This is our second webinar of a series that we launched a couple of weeks ago, looking at supporting organisations to deliver improvement in pretty challenging times. I'm going to sort of not spend too long introducing things, and I'll hand over quickly to Nick. But I'm really excited about today's webinar. I think for me, this is probably one of the most challenging aspects of improvement. How do we motivate our teams to not only continue to look to improve, but start new improvement programs or reinvigorate old improvement programs when things are really tough? So one of the key things around that is creating a social movement about why it is important, why improvement is important. And so we have some expertise in this area, and it gives me great pleasure to introduce Nick, and I'll hand over to Nick and then we'll open it up to the floor for questions and facilitation. So Nick, thanks very much, and over to you.
Thanks, Andrew. It's great to be here and hopefully spend the next sort of 25-30 minutes just sharing with you just some thoughts really about social movement and how we create that social movement, as Andrew was saying. And then afterwards we will have a chance for some questions. So any comments, please put that in the chat as we go through, or just raise your hand at the end of it. I'll hand back to Andrew and we can facilitate those questions if we have any. So welcome everybody. Hello, my name is Nick Holding. I'm an improvement manager with the Emergency Care Improvement Support Team. We're with ECIST now for about 4 years, and I suppose as Andrew was saying, this is an area that I feel quite passionately about, and I quite enjoy this element of improvement. So I think it's important to start with a sort of look in terms of what's the background, how do we create the environment, the right conditions to develop a social movement, or really any kind of change which involves people is a social kind of activity. So is the ground receptive to that change? Have we created the right conditions? Have we improved the quality of the metaphorical soil before we plant those ideas? Because we know that, you know, we spend a lot of time on change and improvement efforts, but sometimes we haven't necessarily always created the right environment for those to succeed. And you know, this quote from Eli Goldratt, he talks about any improvement is a change, but not every change is an improvement. And I think we can all recognise that. I know I've seen many supposedly improvement efforts not actually result in any kind of improvement. So we end up focusing on change, but do we always see the improvement as a result of that? That could be through lack of measurement, or through purely because that change that we've made didn't actually make a difference. And sometimes, in the worst case, it actually makes things worse. So there's a survey that was done back in late 80s, but has been repeated many times that across many industries that shows 70% of change efforts or improvement efforts fail to achieve their overall objectives. And that's quite a startling number for me. This was quite surprising when I sort of dug into this. I think 70% of all change efforts fail, and I think, you know, that despite this study being quite old, it has been, as I said, it has been repeated. And I think just anecdotally, I've experienced this over the past, you know, sort of 18 years of being involved in improvement within the NHS. But I think more importantly, more startling for me, what we also see is that only 25% of change efforts actually only achieve some of their objectives. So that really only leaves 5% of all improvement efforts lead to a sustained change or improvement. That's quite extraordinary, really, when you think about all the effort that goes into change and improvement across all the work that we do across the whole of the NHS. We only get a 5% return on investment. And these numbers, you know, when we really think about this, we have to do something different here, because doing the same old is not going to get us the results we want. So I'm starting to dig into this a little bit, look at some of the results from this survey and the repeated surveys, and see some of the themes that come out of that. And what it showed that with a lot of things, there are unrealistic expectations that are set at the outset. People can't buy into it. They don't understand what it's about. Those expectations that have been set out are completely unrealistic. Lack of buy-in from people, poor communications. Has it been explained well enough? And this is where we really start getting to the social movement now about, has that change and improvement, has the aspiration been explained well enough? What's my role in this? And simply put, what's in it for me as well? This has to be about what's in it for our people as well. How can we describe not just what's in it for our patients and service users, but what's also in it for our people as well who are involved in those processes? Poor utilisation of existing skills. Are we focused on job titles, or are we truly understanding what are the skills people have that are in our teams? Are we utilising those skills appropriately, or are we relying on tried and tested roles or job titles to deliver the changes? Are we utilising the people who know the work best, i.e. the people who do the job every day? Do we understand truly what the time commitment is? It goes back to the unrealistic expectations. Sometimes we'll set things off in terms of a 3-month project plan, 6 months, 12 months. Is it realistic? I see way too often we'll have a short-term improvement or a project. We'll employ a project manager on a 6-month short-term contract, and we assume that it's going to be fixed within 6 months. And that really relates to the improvement mechanisms that we adopt. What is our approach to improvement? Is it top-down, hierarchical, action plan, solution driven, or are we truly thinking about how we can embrace and support our teams to develop those ideas and improvements and really develop that social movement? So when we think about the investment and the time that we spend actually involved in improvement work and all the people and all the resources, when we see the return on investment we're getting, isn't it time that we realise that this particular horse is probably dead and we need to get off and stuff and find ourselves a new one and find a different way of doing things? So with that in mind, I want to share with you a little short story that I share quite often when we talk about this kind of work. Someone you'll know very well, a little character called Winnie the Pooh. So this is chapter 1, paragraph 1 from A.A. Mill. Who goes, "Here comes Edward Bear now coming down the stairs behind Christopher Robin. Bump, bump, bump on the back of his head. It is, as far as he knows, the only way of coming downstairs. He's sure there that there must be a better way. If only he could stop bumping for a moment to think about it." And if we just stop for a moment to think about the improvement work that we're involved in and the traditional ways that we operate in that improvement work and the tried and tested ways that we do that, and we realise that it's not getting the results we wanted to, we suddenly realise that it's not necessarily broken. It's just that we've created it that way, and we've created the environment and we've created the processes and the systems of our improvement methods to actually get the results that we get. So as Einstein says here, we can't solve our problems with the same thinking that we used when we created them. We have to find a different way. If we want things to change, we have to do things differently. But we also can't just hold our breath and hope for the best. We can't keep relying on those mechanisms that we always go back to because it's just simple. Those simple ways that we operate, because it's just the way we've always done things around here, clearly aren't working. We've got to try a different way, and those different ways are often quite difficult and complex. But it's about how we can embrace those new ways of thinking, new ways of working in our improvement efforts, and not solely rely on the simple way of just picking up the usual mechanism and the usual playbook for improvement, where we just probably rely on project-based action plans. So it's about how we take those less well-worn paths to a different way of working, and not using the same old paths that could just bring us back into the same direction again. And a few quotes I often share with people, and it talks to this. If you do what you've always done, you'll always get what you've always got. And that famous quote from Einstein there, the insanity one, is doing the same thing over and over again and expecting different results. And the one at the bottom, as we just talked about, I think it was Don Berwick. Everyone talks about being Don Berwick, but it's also been attributed to Paul Battleton and Edward Deming. Every system is perfectly designed to get the results it gets. So when we're thinking about our improvement efforts, when we're thinking about how we develop a social movement for change, if we think about just how we develop improvement efforts that stick, we've got to find different ways of doing it, because as Don Berwick says, the systems that we design are perfectly designed to get the results they get. So that was a bit of background, a bit of how we started to sort of identify the culture around social movement, but how did we start building that now? How do we start moving forward and think about the actual mechanisms to create those particular changes? And this is something I've sort of thought about for some time, and pulling together this idea of how do we think about improvement as the anatomy and the physiology of improvement. And I was sharing these thoughts with somebody I know called Dr. Bernard Crump from Warwick Business School, and he helped me flesh out some of these ideas really, and I started talking it through with him, and he's helped me understand a bit more. And what I was trying to get at was the anatomy. What we often focus on is the anatomy of improvement. So we focus very heavily on the training, the governance around improvement, project plans, action plans, structures, job roles. It's the functions and the framework of improvement. And we believe once we've set that up, we assume that the improvement will happen afterwards, but we don't spend enough time trying to understand the functions within those structures. We don't try to understand the cultures, the people, the relationships, the interconnectivity, the interdependencies of those people, and what's in the mindsets of the people involved. How we develop a social movement is by truly understanding what's happened within the structures, but not just setting up the structure in itself. What does the leadership look like in that area? I don't just mean what does the management look like. I mean, what is leadership? And leadership can be attributed to all sorts of people, not somebody just in a defined leadership role. So when you think about how you take forward your improvement ideas and your improvement thoughts, try and think of it in terms of this, how we go beyond just the anatomy of the structures that we create and start thinking more about the physiology. When you think of a really good example of social movement, I always go back to it. There's a few key ones which I'm going to share with you. And this one for me is probably one that stands out more than anything else. Martin Luther King. I use this as an example because this was something that was developed in a pre-internet age. Martin Luther King mobilized hundreds of thousands of people across vast areas of the country to come together behind a single message. This was about how he shared a single aim, a single objectives. It was really clear people could get behind that. This was true social movement. What Martin Luther King said, he said, "I have a dream." What Martin Luther King didn't say is, "I have an action plan." Somebody else who's done really successfully well developing their business by sharing a really clear aims and objectives is Steve Jobs. When Steve Jobs set up Apple and he was building a business, and he continued to build a business, and something that Apple buys into continually, Steve Jobs started by saying, didn't start by saying we aim to develop a 10-point strategy. What he actually said was we aim to challenge the status quo. So when you set your aim out and be really clear, people can buy into this. People can buy into this message, challenging the status quo. I have a dream. These are aims which are really clear and simple for people to buy into. It's not top down. It's not hierarchical. Steve Jobs didn't tell people what to do, nor did Martin Luther King. He gave them a clear aim and a clear vision, and he encouraged them to get behind that vision and do whatever they needed to do to be able to help achieve that vision. That's when you start to achieve social movement. So I just believe it's time to start to rip up the old playbook, to rip up the tried and tested SOPs around improvement and change, and tear apart that action plan and start giving people a bit more freedom, give people some inspirational messages to get behind, that give them the opportunity to try things out and test and fail and try again, but all supported by a really clear vision and a really clear aim. That's how you develop social movement. For me, another really great example of a social movement is Hello, My Name Is. Hello, My Name Is was developed by Dr. Kate Granger. Kate was a consultant geriatrician, and she spent some time in hospital having cancer treatment prior to, unfortunately, Kate passed away in 2016. But before she did, she developed this fantastic social movement around communication between healthcare professionals and patients. And it evolved into so much more than that. But it started with a really simple, clear message. What it started with was Kate was in hospital. Kate had been in hospital She had cancer treatment. She was post-op. Doctor came into her room and began talking to her and delivered quite a blunt message that her cancer had spread, which was quite unexpected. And the doctor left the room. And for that short moment, in that real psychological trauma that Kate experienced with that message, what happened afterwards that she suddenly realised that actually the doctor never introduced themselves. And what she was finding that more and more often that was happening. Healthcare professionals and other people weren't introducing themselves while she was in hospital, and then after that, and it became really, really obvious to her, and it really started to annoy her, and she get quite passionate about this. So the quote on the screen now is from her husband, Chris Poynton. He said, "Well, stop whinging and do something," which I think is a sort of, what a great message. Stop whinging and do something. I think we can all get behind that. So she did, but she started something really simple. But there was no action plan. There was no money. There was no project plan that sat behind this or project initiation document. It was just Kate starting with a really clear message that people could understand, and it was simple enough that people could understand. And this is the fundamental basis around social movement. Make the message simple enough that other people could understand. As Einstein says here, if you can't explain it simply enough, you don't understand it well enough. And that applies to our people as well. If other people can't understand it, how can they share it? How can they get enthusiastic? If the concept is over complex, people aren't going to buy into it. So how do we keep the messages really simple but really practical that people can understand? And essentially that's what Kate did when she started Hello, my name is, and we can see where it's gone to now. It's all over badges and posters, and it's gone global from a really simple message. And what a great legacy that Kate has left behind for us. Another great example of this is, which most of us will be very familiar with, is the Mpg Paralysis Movement. Hashtag Mpg Paralysis, initially developed by Professor Brian Dolan. Started off with a really simple, clear message, just getting patients up, dressed, moving out of bed where possible. What Brian did is made the message really clear, really simple, got a few enthusiastic followers to get on board, people like Anne-Marie Riley, Tim Gillett, Pete Gordon, but other people quickly got on board with this message because it was really simple. The messaging was the clear aim, clear objectives. People could feel passionate about it, but they were left to their own devices. This sketch note here you see in front of you by Sonia Sparkles. I encourage you all to follow Sonia on Twitter. Some really interesting sketch notes that she produces. Sonia wasn't asked by Brian Dolan to produce this sketch note. She understood the message. She felt passionate about it because she could see where it was going, and she felt compelled to produce the sketch note. Similarly, Dr. Amelia Crabtree from Australia wasn't asked by Brian to write a book. Amelia's a geriatrician. He didn't get asked to write a book by Brian called Get Dressed, Get Moving, Get Better. She understood the objective, she understood the aim, and she felt compelled to get behind it. This is where true social movement happens, when people can adopt and adapt the message, don't feel like it's constrained, and feel free to get behind the movement themselves and feel like they can contribute. So both Sonia and Amelia and thousands and thousands and thousands of other people just took the message of ending PJ paralysis and applied it in their own areas and interpreted it in their own ways. And this happens because we develop these connections with people. The various connections we establish, the various networks we establish, all leads to the development of social movement. So if we rely solely on our strong ties, and this is something that describes strong ties, such as the cohesiveness of line management and hierarchy and project groups and committees. It's those strong ties between individuals. What we find with those strong ties is the spread doesn't go far enough. It remains within the bubble of either that line management hierarchy or within that project group. Where you get true spread and true social movement is where you embrace and build your weak ties. And weak ties implies a negative thing, but it's not. The weak ties means that it's not as established. These are interconnectivity of various people across random networks. It could be through social media, it could be through conversations. But those conversations and those connections are established because the messaging is simple and people become enthusiastic about that information and that knowledge, and they want to talk to other people and want to share it. The whole movement around PJ paralysis, the global movement now around PJ paralysis, has just happened through conversations. There is no money behind that. There is no master plan. It still evolves through people just buying into it. And this relates to a piece of research that was done by Dr. Nicola Burgess from Warwick Business School. She talks about this in terms of, she calls it social network analysis. This research she does, and it shows the interconnectivity of people and the knowledge sharing around improvement. And here there's an example of limited interconnectivity. What it shows is the improvement activity is quite dispersed, but people aren't talking to lots of people. They're talking to small groups around them. There's limited, as she puts it here, low to moderate connectivity between individuals. So there's limited sharing of knowledge and information, and limited engagement, limited enthusiasm and excitement. How does that manifest itself through other people when your networks are quite small? Compare that to another trust where there is a high degree of connectivity. There's dense clusters of people talking to each other and sharing information and sharing knowledge. People aren't talking to one or two people, they're talking to lots of people. And that interconnectivity means that the messaging broadens and shares wider, and this is where you get true social movement. And anybody who's ever heard Göran Eriksson speak from Jönköping County in Sweden, fascinating guy, and some of the work he's done over there in Jönköping is amazing stuff. He talks about how we see through the lens of social science. This is all based on social science, and I won't go into it, but that's probably a different talk for another day. But he talks about real change arises through working with informal processes more than through formal change management. So we set up formal change management structures, but actually the real change happens through those informal processes that we find. We understand and remember by interpreting. So this is how we adopt and adapt a principle, not just by being told what to do. How do we understand and remember that? And we do that by interpreting it ourselves, taking it on board and interpreting the message ourselves, and having that freedom to be able to do that. Some perspectives we select, other perspectives guide us. So this is a really key message here about some information we find and we hear and we're exposed to. We choose to take on board as they are, and so yes, we believe that, and I'm going to take that on board and I'm going to move forward with it. Other perspectives just guide us and they influence us in certain ways. We don't take the message verbatim. What we do, we take the message and we interpret it, and it guides us in a different direction. But he's really clear about how we can avoid the narrowing of reality. So what that means, he talks about the narrowing of our realities by meaning that we're constrained in our thinking, that all our thoughts converge on a single particular set of solutions, and we don't end up having a convergence thinking where we broaden the ideas and we broaden the scope. So we end up having a more broad reality that we can see different ways of working. So as we move towards bring us to a close now in this session, I want to think about how we've talked about the background, we talked about some of the cultural side, some of the thinking, and now a bit more sort of practical stuff. And this quote for me sums it up from Stephen Covey, and he talks about how we should begin with the end in mind. So some real practical things now about we begin all our work with the end in mind. Any improvement work, we should know what we're trying to achieve. We may not know how we're going to get there. And that's the key point here with social movement. We don't write the action plan. We don't write down all the solutions that tell people what they need to do, but we're really clear about what it is we're trying to achieve. But the problem is, what we often find is that our expectations are that we have a start point and an end point, and we believe it's going to be quite a linear process. We write all these our actions down in our action plan, put people's names next to it and a date next to it. We believe it's going to be done, but I've lost count of the amount of action plans that just end up being a tick box exercise and a reporting mechanism. The reality of improvement work is that we still see the start and we can still see the end. but in between there were a whole lot of pitfalls and successes and wins and deviations and other things that we don't even know is going to happen yet. And that's what we have to be prepared for. But if we're really clear about the aim at the end, and we can see the aim and we understand the aim, we can manage and deal with all these variations. But the aim really gives us that clear sense of direction. And another quote here from Stephen Covey: "The ladder is not leaning against the right wall. Every step we take just gets us to the wrong place faster." So without really understanding where we're trying to get to, that real clear aims and objectives that develops the social movement, we're not going to be able to head off it in the right direction. But we have a role as leaders in this to avoid the pitfalls that we start thinking about the people are part of the problem. It's never, the people are never the problem, probably not never, but hardly ever. I talk about this a lot, about it's the process, not the people. If we always focus on the process and not the people, we can start make some movement. Some really good people are working in some really poor processes. So it's up to us, it's our roles as leaders in improvement work, is to help remove some of those failures and deficiencies within the process to allow our people to progress and test and try those different ideas, rather than just focusing on individuals. Because we know, as Eisenhower says here, you don't lead by hitting people over the head. That's assault, not leadership. So stay focused on the goal. The goal is really important. Developing a social movement means that people are focused on the goal. It's not about the change itself. It's about the change leading to a goal. It's about recognising, going back to that point from the McKinsey study, 5% of change efforts, only 5% of change lead to improvement. So how do we start focus on the goal rather than just the change itself? But that requires effort, and that's where we have to do. We talked about, rather than the simple solutions, trying some of the more difficult, complex solutions. When we start to develop social movement, this is about how we can create a vision, how we can create the messaging to get that right. But that's not about pontificating from mountaintops all the time. It's about how we can share that message, but how do we get down and work alongside people? How do we walk alongside and walk and talk the same message? I talked about Brian Dolan before. Brian Dolan could very easily sit on Twitter all day and tweet out his message, and people would still listen, but it wouldn't carry on. It wouldn't progress as much as it did do. What Brian does, he lives in New Zealand. He gets on a plane regularly and goes all over the world to walk alongside people, to share their message, to share his message, and to support other people's messages as well. I'm going out to see Brian in a couple of weeks' time. He's coming over to talk to teams in the UK. So this is about how we also walk alongside people as well to help support the messaging. People like, if you look back at early on, I was talking about Martin Luther King. Martin Luther King walked alongside people. Steve Jobs walked alongside people. We also have to get alongside our people so we can understand what challenges they face every day. So I just think it's time that we think different now. We have to try something. We recognise all the things I've just described about the 5% of change efforts failing. Just because we haven't done it before doesn't mean say it won't work. But from what I can see, we've got people out there who are desperate to be let loose and try different ideas. They want to break free from the action plans, from the solutions, from looking up, being told what to do next. Give people the flexibility and the freedom, allow them to try different ideas, allow them to fail, give them the vision and give them the inspiration, and they will almost certainly come up with those improvement ideas that enables you to test them and see where they go. But having that freedom to be able to try that out is so important within social movement. But I suppose this is not all just my opinions. There's a bit of evidence that sits behind this. Well-known model from Cotter has been developed. For John Cotter developed this many years ago, and for me it still holds true. What we're talking about here is those first 3 stages. We're talking about how we increase the sense of urgency around a particular aim and objectives first and foremost. That comes from a really clear messaging, really clear aim. What is it we're trying to achieve here? From your improvement work, what's the overall aim? How can we inspire people and develop that urgency? How do we build that guidance in a small group of people, the the Anne-Marie Rileys, Tim Gillett's, Pete Gordon's, the people who get behind the message initially. How do you build your small guiding team of enthusiasts to help take that message forward? But getting the vision right is so important, because that then does help move on to the next stage, which is about how you communicate that messaging. Think about the McKinsey study. Poor communication led to lack of buy-in. Empower people to try things out. Don't tell people what to do. Give them the vision and the inspiration, and allow them to try their ideas out, and empower them to move forward some of their ideas. Short-term wins, those quick, easy, low-hanging fruit, that starts to build some momentum. When people start seeing some easy results, they feel empowered and they feel emboldened to carry on. And the last stage is the most difficult bit, is how we continue it. That's about how you change the messaging. So don't stick to the same old messaging. How do you stick with the same aims and objectives, but just changing the messaging a little bit and then make it stick? But above all, I suppose it's a long journey. Often it's a long journey, but it all starts with a single step, and that single step can sometimes it be just the way we operate and how we change our improvement mechanisms. So as the quote here from Confucius says, a journey of 1,000 miles begins with a single step. So always think about that first step in the process. So really quick canter through a subject which is quite complex at times, but hopefully give you a bit of a summary on what we're trying to share with you in terms of how we develop a social movement for change. Hopefully you got the key messages there, but a few takeaways. Let go of the action plan. This is about how you empower people and give people the inspirational message. Start with the end in mind, and know what it is that you're trying to achieve, because if you don't know, then nobody else will know either, and you can't share that message. Where are your weak ties? Where are those interconnectivities, those networks that you can develop? And don't overmanage this. When people feel overmanaged, they won't buy into the whole concept, and they'll feel constrained, and they'll lose interest. But be really clear about that clear vision, the I have a dream. But above all, I've said it before and I'll say it again, if you can't explain it simply, you don't understand it well enough, and that goes for the same for the people who are out there. Really clear messaging inspires that social movement, and look at all the examples I've given you: Martin Luther King, Kate Granger, Brian Dolan, Steve Jobs. It's all about developing social movement. So thank you very much. A few references just to leave you with in terms of books. Always highly recommended from my perspective: Stephen Covey's 7 Habits of Highly Effective People, Simon Sinek's Start With Why, and John Cotter's Leading with Change. Andrew, back to you.
Nick, thank you very much. That was a great overview, and I particularly like the kind of almost the academic background behind it, the sort of evidence base. I was wondering if we could just, because it's a personal favourite of mine, you wouldn't be able to put up the Cotter's 8 steps again, would you? And just leave that up, because I think that might be a really good place for us to start our conversations.
Bear with, and I shall attempt to reshare. There you go. That should be coming up now.
There we go. It's just coming through. Lovely. That's great. Thanks very much, and worthy applause in the virtual room for you. So take a bow, Mr. Holding. Now I'm going to be a bit naughty, because I'm going to ask some difficult questions. I hope some challenging questions. So and I'm going to pick up on a theme that Piyush has put into the chat. And he's referenced Simon Sinek, and one of the biggest challenges I think for us at the moment is the why, and particularly when we're talking about discharge, hospital only discharge, and focusing on uncomplicated discharges. We've got unmotivated, de-energized, really struggling teams, and often the why is the big question. So I could discharge someone earlier, they're only going to be replaced by another patient, and that may not be the patient I want either, all those kind of things. So I don't know whether you or anyone else on the call have got any top tips on how we change or influence that why conversation. Does that make sense? So looking at this sort of early, creating a climate of change.
I'll pick up on that, and then obviously I'll open it up, and I just wanted to go back to Pijushi's point there that and it's fascinating we talk about the infinite game as well, because that really it goes back to that. If we see things in terms of a accomplishment of an aim or targets, we want to do this within three months, for example, or we focus solely on that endpoint, when actually this is our aim should be continually evolving. We should be thinking in terms of never achieving what we set out to achieve in the short term, knowing what we want to achieve in the short term, but it's continuous. It's not about if our focus only ends up being on the next 3 months, then we have short-term thinking in our minds, and that goes back to the why question. Is if we have short-term thinking in our minds, we're looking for short-term fixes, and those short-term fixes drive us towards making rash decisions or only dealing with the superficial. So in terms of your example about discharging a patient, why should I discharge a patient now because I'm only going to get another one? Well, that's short-term. That's short-term thinking. It's not understanding what sits below that. If we only ever think about the superficial, that particular problem, we're not thinking about, okay, well, let's dig a little bit deeper. Let's dig a little bit deeper into what's happening in ED right now. That means that we just by discharging that patient means another patient can get the care that we need. So it all ties into developing the mindset, not focused on short-term quick fixes, but thinking about this is a long-term aim that we can always get behind. And this is about, whatever that message might be. For me, it's how can we get patients home sooner? How can we get patients to the place that they would rather be? I mean, no offense, but patients don't want to be in hospital. As much as it's our world, patients want to be home at all, or wherever home might be. So that's the vision here. And that goes back to some of Brian's stuff around getting people up, dressed and moving. That's something that doesn't end. It just becomes a continual mess. I wanted to bring PJ, actually, if you want to sort of pick up on that as well, in terms of, you asked the question, was there anything you want to sort of raise?
Yeah, I recommend everybody to read that book, The Infinite Game, where it says quite clearly that sometimes we don't have a mission accomplished, and as soon as we do that mission accomplished, it just starts all over again. So we need to get, a mindset where better never stops, which is what our UHCW, in our hospital, Coventry, where we are, is our sort of motto. Why are we here, and what is the purpose for us being here? And if you ask about 100 patients whether they want to be home, 99% will say yes, I want to be home. That what we don't do is that we then end up in recommending that they stay in the hospital because they are at risk of going home. Instead, what we should ask is that, basically, flip it and say that if you want to go home, these are the risks that are there. We document those risks, and we respect the patient's wishes and make sure that those risks that are there are addressed, in the community, instead of just stopping there and say, oh, you're too risky to go home. So that's where we are just missing a trick, and that is what I wanted to say, basically, that we empower the patient to decide where they want to be, not us deciding that this is going to be good for you. The hospital is going to be good for you. Hospital is never a good place to be. Home is where the heart is and where you should be, and that's where Mpg paralysis came, and that's where I, as a geriatrician, I'm very, very passionate that we respect our patients' wishes. That's all I have to say.
I think you're absolutely spot on there, and what several times there, it's just a really clear, understandable, simple aim. It's not, you're not giving people instruction, you're not telling people what they need to do. What you're giving people is a really clear aim, and this is what we can all get behind. and they can apply that in many ways. In that better never stops mindset is that we're recognizing that we can always be better than what we currently are. It's a really simple message. Patients want to get home. How can we do that as soon as possible? That's not focusing on necessarily discharge. We need more patients out. Come on, crack that whip harder. That's providing a more intrinsic motivation rather than what we believe often we rely on is the extrinsic motivation of big sticks and targets and action plans. What you're talking about more there is how we motivate people through intrinsic motivations by asking them to connect with the people and the patients to try and get them home, and then they can interpret that however they want. And some people will come with some quite radical solutions. So I think you're absolutely spot on with that.
So thank you both. Really important. And I have to say, my reflections as I was listening, Peter, was, as a junior doctor, I was very fortunate with the clinical leaders who mentored me and I worked with, and I think increasingly I see that clinicians, and by that I don't mean doctors, I mean all clinical staff, all frontline staff, are quite distant from patients. A patient has become quite abstract on a ward when you're running around. And if we bring it back to, as I was always taught, if that is your loved one, your brother, sister, mum, grandma, whatever, actually does change the dynamic. So just making it a little bit more personal and I won't say real, but you know what I mean, more meaningful perhaps, as on an individual personal basis, may help some of those questions or some of those discussions. I wanted to bring Erica in, if I may, because Erica's talked about her experience of shared meaning and sharing visions and things, and Nick, you talked about what's in it for me, and we know that we've done some work on ward with frontline teams where we said what's important to you and use that as a driver, as a motivator for change. Erica, you've got some experience here. Would you care to share with us? That'd be great.
Of course. I guess there's always a temptation, isn't there, given the pace of the minute, that we rush off into change and try to get it done as quickly as possible. So certainly when we were implementing criteria to reside in a previous role, we really took the time, and it's just looking at the chart, building that guiding team, that faculty, I guess it has kind of different names, but establishing that stakeholder group and building whatever vision it is you are developing with them, not only kind of increases that sense of ownership, but gives purpose to the project. And it means that people then have a deserved stake in the outcome. So I guess, that initial investment of time and effort could pay dividends throughout the entire course of the project. So certainly, I would always favour that approach going forward, having had the opportunity to experience the benefits from it.
Yeah, thanks, Erica. And the other thing is, of course, there's the added unseen benefits from that, isn't there? The sort of knock-on benefits, because you've got a shared vision. Actually, that shared vision then spreads more widely across other aspects of care and other aspects of work. And Nick, you spoke about the disconnected networks, and I agree that's actually a positive thing. That sort of that web, that that socialization that will spread amongst organisations. People work on different wards and different teams, so they will cross-fertilise those improvement ideas. Now, I just wanted to sort of acknowledge some of the stuff we've talked about today, because I'm aware on the call we've got many senior leaders, and I just don't want to underplay the fact that we fully acknowledge it's all well and good us saying ripping up action plans and that kind of stuff, and we know that is not possible. I think what we're trying to highlight is that actually for the frontline clinical teams, and I use my sort of benchmark as an FY1, FY2 on a ward, and a band 5 nurse and a band 5 therapist, actually they don't care about action plans or performance targets. It's that to them that is not engaging, and us as leaders, we have to deal with that, and that's the price we pay for the jobs we do, I guess. And the social movement is effective when the performance stuff is parked to one side, and the focus is all around improvement. And I think for me that, you know, I will happily go on record to say I don't actually care about any of the targets, because actually what I want is an improvement. So as Nick said, you know, it's and PJ has highlighted, this is a never-ending thing. You know, it's not going to get any better. We're not going to get more beds, and we don't need more beds. We need patients to be in hospital for the least length of time possible, and that aspiration will never change. So putting an arbitrary target about it is not necessarily very meaningful for me personally, and I accept that may. I'll be in trouble for the rest of the day again. I wanted to ask Nick, because I know you've got some real experience in this area, and I know we've got Paul on the call as well, and maybe Paul would like to come in as well. I'm interested in the use of social media to generate a social movement, because it's something that I'm a total technophobe. I've got a phone, it works as a phone, apparently does other stuff, God only knows what. So how any top tips on social media, Twitter, Facegram, Insta tweet, or whatever it is, you know,
all those, yeah. So yeah, I tweet a lot, I guess. So I'm a bit of I'm a bit of a convert, but for me, it just goes back to the simplicity of the message. It's just another network. So it's just another, you know, before social media, we had other ways of talking to each other. You know, back seems like a very long time ago, we used to have conferences, and we used to talk to each other, and we used to mingle and chat. It's having the simplicity of the message. So social media is only a vehicle for sharing the simplicity of the message that people can interpret. If they're only feeling like they only repeating a standard message, then people won't share it via social networks, because they can't connect to it themselves. People use social, I mean, without going into the whole neuroscience behind social media, but the ability to connect with other people and, you know, get those little red notification markers is a little bit of a buzz for us, and when we like that. So if we can generate content that drives that connection with other people, then we'll feel good about it. And that's where social media really works, because people can generate the content themselves, but if they don't know what to share, if they haven't got the sense of purpose that sits behind it, that they can share on across those networks, it won't progress as far as it could do. And we know, when, you know, the simplicity of across social media is that the spread then can go quite far. You know, we know from the work that we did around the Modern Water and Collaborative recently, some of those tweets and LinkedIn posts and other things that we were putting out there are reaching places that we never even imagined they would reach. So it's the ability of social networks to cross geographical boundaries. You're not relying on the canteen or the metaphorical water cooler moments, but for me it comes back to, it can't be seen as a tool. Sometimes there is a reliance on, we're going to put some tweets out, we're going to do this, we're going to do that, we're going to rely on social media as our communication mechanism. And I've even seen organisations kind of rely on social media for some of their internal communications as well, which, you know, just feels a little bit odd, particularly around improvement. I was on an improvement session yesterday around the mental health network, and they developed the hashtag mental health improve, and people could get behind that. And when you search that particular hashtag, it meant that there was so many more people connected to that. But that was just about a really clear aim around developing a network of people, other people with the similar roles, similar improvement, communities of practice. That's where social media can play a part, but it comes back to that, people being connected to other people. But if you haven't got a really simple message that you can share, that people can generate their own content, then social media won't deliver what you wanted to deliver. Paul, did you have anything to? Sorry.
Before I bring Paul in, if that's okay, I just wanted to add on that. So that's a really good sort of point to summarise, Sir Nick. So actually embracing social media, not necessarily managing it or relying on it, but actually using the kind of principles of social media to distill your message, your improvement message down to into its most simple sort of form. It is a good technique, a good trick.
Yeah, and and I just, as you were talking, I was just reflecting that, the PJ Paralysis campaign, it's always got the hashtag PJ Paralysis, but it's almost left the social media world and become a thing in itself. Hashtag PJ Paralysis gets put on posters and other things. It's no longer contained to a hashtag. So it may have started that way, but that only evolved based on the original principle. The hashtag wasn't the starting point.
Yeah,
that was evolved with a clear message.
Thanks. Paul, I don't know if you wanted to come in.
Yeah, hi guys. Thanks, Andrew, and thanks, Nick, for a brilliant session as ever. Yeah, well, Nick's we're lucky to have Nick in terms of one of our expert social media gurus. But I'm just a mere kind of amateur user of it. But what I've learned over the past couple of years is to hang out with people who actually really understand it, and also to use it as professionally as possible. So we've got the NHS Fab Academy that often run social media campaigns to such an extent Twitter locks them out for the day because they exceed the maximum Twitter count allowed by the platform. Now that takes quite a bit of understanding how you get your message out doing that, but it just shows you we've got people like Fab Academy and Rachel who can do that for us. And I think the other thing to be aware of is, as Pete often says to us, it's about getting our message out to the hands of the many. And we need to understand that 45% of the world's population don't have access to cell phones or the internet. And these aren't off-the-grid hippies who've withdrawn from civilization. These are the world's top thinking brains in terms of science, medicine, social science, innovation, research and development. They just happen to be residing in parts of the world that do not have access to cell phones or the internet. And that's a lot of people, 45% of the world's population. So that's one target area we need to think what platform is available to tackle that. We do have access to a platform to tackle that, and we use that. Most recently, that got us to our 35.5 million reach for our Get on the Edge Care campaign. And I think the third aspect for me with the social media, but in terms of communication reach really for public services, is using the professionals. So we were incredibly supportive to get the backing of the BBC radio broadcast controllers because they were running a campaign around how to improve emotional health and wellbeing over the last 2 years. And tapping into them, it was called BBC Making a Difference. We had a call with the Director General of the BBC, who introduced us to 7 regional broadcast controllers, and they latched us into their regional campaigns for making a difference in our communities. So that was a mix of social media. It was also a mix of broadcast radio and other mediums as well. But that transformed how we get our message out at ECIST, absolutely transformed it. But it's an amazing science, I think, as Nick says. Thanks, Andrew.
Yeah, thanks, Paul. And I'm chuckling to myself, sort of 45% of the world's population and 99.9% of the world's consultants, I suspect, don't use their phones very effectively. I think the other thing, just bringing it back to more small scale and local for the people on the call, is obviously linking it with your local press. So local papers, local media outlets, those kind of things, because actually most of your staff will live locally. So, I know hospitals that have used sort of going home for Christmas kind of campaigns, that kind of stuff, and have done that with their local papers, and they've had adverts on buses, those kind of things. So thinking outside the box on some of this, and again, focusing on improvement rather than performance. The other thing is that to emphasise the importance of celebrating success, and that there will, in all of your organisations, there will be successes to celebrate every day, all day, every day. and I think that's really important for you. It's really important for the staff, but also when it comes to other outlets, actually it's a good news story. We need good news stories at the moment because we're surrounded by not good news stories. So in terms of good news stories, I'm going to actually draw us to close 4 minutes early, if that's okay. Just to say, the next week there will be our first clinical drop-in session. So this is will be hosted by the clinical directors from ECIST, and is for your clinical teams to drop in at any grade. It doesn't have to be leaders, it can be anyone who'd like to drop in, ask us questions. There's no agenda, it's just a free-for-all to come and bring sort of hopefully a problem sharing, a problem solving kind of workshop, as it will. Details of that will follow. Any feedback was really appreciated by us. We really want to make these useful, so if you've got any comments, please either put them in the chat box or scan the QR code that Crystal's kindly put on the screen now for us. And in terms of the next improvement series webinar, that will be coming out in the next 2 weeks, so watch your mailing list. Again, this is really ideally for the many, so please, we will send out the slides set and the recording and links to our futures platform in the next 48 hours. Feel free to share it to everyone, encourage them to join. If they email us, we can plug them into the diary invites. So without further ado, thank you all for your attention this afternoon, for making the time to join us. Thank you particularly to Nick for an excellent presentation, Crystal for seamlessly making everything work behind the scenes, and to everyone, I hope you have a very good afternoon. I will see some of you in about half an hour's time, and the rest I will see you soon. I hope to see you next time. Take care, thanks very much, and see you again. Bye now.
Bye everyone.